more than 90% of her body surface area was peeled off. I was not aware of all the sacrifices I would have to make.
Any advice to kind of young medical professionals who look up to you?
There were days when I used to cry coming back home. Breaking the news is very, very difficult.
Being a woman in the medical field, how has it been?
I had actually lost hope from life itself. Already the patient is in pain. Their family members are agitated, they are angry. It comes onto us.
I can't even imagine as a non-medical professional how frustrating it must be to not know.
There shouldn't be such an incident that has to be there to open your eyes.
The last couple of years have made us realize that the lives of doctors and nurses and technicians in this country is not ideal. Well, hello and welcome to KNYA's podcast, where we bring medical professionals to speak about their stories, their backgrounds, and an opportunity for us to celebrate them. Today we have Dr. Rajvi. Dr. Rajvi is an MD Dermatology at Seth GS Medical College and KEM Hospital with a focus in dermatology. She secured an All India rank of 312. Incredibly impressive. There are thousands of medical professionals that look up to her for her guidance, for her inspiration. And today, we are very lucky to have her. So thank you so much for coming here today.
Thank you I'm really grateful for you having me called here. And I would hope this podcast helps at least one person in some or the other way. That's the only intention here.
Amazing. Thank you so much. So let's start, doctor. Could you tell us, did you always wanted to be a doctor while growing up, or did it come up later in your life?
Honestly, I had never thought in my dreams of becoming one. I was more inclined towards art, towards expressing myself in my paintings. Actually, I have a twin sister and we had similar hobbies. And growing up, I used to think that we would be designers, designing some clothing or homes. But it was in my 11th grade when we had to choose a subject. And that is when I chose biology. And this is where I am now.
And any thoughts now that you're a doctor? Any regrets? Anything?
Absolutely no. There are no regrets. The things we get to do through our knowledge, through our service, it's not comparable to any other field. So it's worth the efforts and the sacrifice.
Amazing.
Definitely.
So could you tell us, what does the day in the life of a dermatologist look like?
Yeah, so currently I'm in my third year of residency in Seth GS. So here, our day starts early in the morning. We get up early and go to the wards at about 6 a.m. in the morning, take the ward rounds, the vitals, and do the patient's dressings, because most of the inpatient people in the dermatology ward, they have abraded skins and peeled off everywhere. So dressing becomes very important. So we do that. Post that are our morning rounds, which start by 7:30, and we rush to the OPD because we have to see the OPD patients. So rarely do we get time to eat our food. And in OPD, we are 18 of us junior residents, and there are senior residents consultants as well. And we see about 400 to 500 patients on an average,
Wow.
the entire OPD. And on alternate days, we get to do different surgical procedures and lasers, peels. So you will get a lot of exposure here, but it will be hectic. And we get done by about 4 after a 2-hour session of discussing different cases. We present live cases in front of our HOD and in the faculty to get their knowledge, to get what we should improve in our managing skills. And post that, we run to the wards again, do the patient's dressing, vitals and stuff. And one of us is always on call. So one of us has to sleep in the ward side room. And we continue the next day till 5 p.m. So it's about 36 hours of duty
Wow.
at times.
Wow. No, incredible respect to you for they say residency is one of the most critical times in a medical professional's life, right? I think in terms of learning and giving back to the community. So kudos to you for, I think, spending that time, and hopefully it's been a rich experience. They say KEM is one of the most reputed and largest hospitals in the country. And you see a diverse set of patients across the country. Do you remember any particular case that kind of stood out to you, not only for your learning, but also the way you kind of treated a patient, right? And how it kind of made you feel, and what were the learnings?
Here, we are blessed to be in such a institute where you get to see different patients. Generally, it's a very big learning experience and also rewarding. So one woman, I remember this, one woman, she had come with her 6-month-old baby. So the baby's skin had peeled throughout, like more than 90% of her body surface area was peeled off and in scales. It was a condition which is known as congenital ichthyosiform erythroderma. So here your skin peels off and resulting in raw areas all over the body. She was in complete real pain. I could feel her, and but since her age was too small, we did not start her on anything, only the dressings. But that night, I remember I going through all the different articles from everywhere. Each resource I had searched intensively. And the next day, I had asked my HOD if we could call the patient back, and we started her on a medicine in the small dose, which would improve, which would definitely lead to some improvement. And within a span of 15 days, the child, her skin was starting to reform, and even previously she was not able to open her eyes and her mouth. She was not able to feed. So all of that was improving, and that was really very, very rewarding. Yeah.
Wow, kudos to you. Kudos to you for being part of such a important case. Doctor, you secured an All India rank of 312 in NEET PG 2021, if I'm not wrong, right? Which is impressive. Congratulations on that, right? And I've seen some of the videos that you've created on NEET PG as well. Any advice to kind of young medical professionals who look up to you on kind of how did you prepare? How did you crack the exam? How did you get the exact branch that you wanted? Any learnings?
The most important thing would be to know your why. Knowing why you are doing the thing that you are into now is the most important thing, to bring more clarity, and so that all the efforts and all the sacrifices, they become more simpler or more easier. And also so that you don't deviate from the path. There will be different circumstances and different obstacles, but they shouldn't matter to you when you have your strong why. So have it, be clear with it, and then stick to it. And post that is become having more practical strategies, like making good proper notes and trusting your notes. It becomes very, very important. And also, if you are not able to improve your ranks, I would say is you analyze yourself after giving mock tests and know where you are lacking, and reread and re-revise those things and topics and make your basics more strong. And also have a hobby to look forward to, like give yourself some break. It won't be a waste of time. It will make your mind more efficient when you come back to studies.
And why did you pick dermatology? Was it a passion that was there from early days of MBBS, or?
My main reason was to have a work-life balance, is what I would say. That was one of the main reasons, to be honest.
Amazing. And dermatology provides that?
Yeah.
Amazing. Amazing. You come from a background of non-medical professionals. You mentioned to me that your parents aren't doctors, your sister's not a doctor. How has that been, right? Because there is a reasonable percentage of medical professionals or doctors who come from a family of doctors, or other siblings or spouses who are doctors. You don't have that, right? And how has that been for you? Has it made you feel different? Has it been a strength for you?
To be honest, I was not aware of all the sacrifices I would have to make eventually. But now that I'm into this, there's no other thing I could think of.
Tell us more. Tell us more about some of the sacrifices you made, and why do you think they're sacrifices?
You don't get to spend that much time with your parents, or even they have to see the struggle that you're going through. The residency, the first year of residency was not easy. There were days when I used to cry coming back home, not able to come back home because of the call nights and things. And it becomes very tiring at times.
One thing, in my conversations with many doctors and medical professionals is that communication becomes a very critical aspect in your day-to-day job. Could you share a little bit about your experience, about how have you become a better communicator? Right? You mentioned that your team and you sometimes meet north of 400 patients a day. That means there's 400 touch points with their families that can become 1,000, 2,000 touch points a day. So how has communication honed your skill set?
To be honest, residencies here in KEM is very hectic. So usually we don't get time to get into the depths of what the person is feeling. We see their skin, ask for the main complaints. So that is the main things which we usually talk about. But yes, in the ward, we do have conversations with the patients, their families, what they are going through, and we try to help in our ways. Because counseling of the patient, because most of the skin conditions are more chronic, like psoriasis and other things, they are more chronic. So here, counseling the patient also becomes very important, because their compliance depends more on how you are able to counsel the patient about the condition and how you give them hope.
Do you think counseling a patient was something that was covered in medical school?
Absolutely no, we were not taught about it. It comes through practice. When you go to the wards, you meet patients, you talk to them, it comes naturally.
And any advice to younger doctors who are watching this on how they should potentially share bad news or have a difficult conversation with maybe a patient or their family member?
Most important is to know what the family or the patient is going through, and try to converse in the way that would feel a bit less huge to the patient.
Do you remember any particular instance on a particular case where you were able to really console the family, or you probably did not do a very good job doing it?
I remember there was one death of a case of erythroderma, where there is peeling of your entire skin. The patient had dysfunctional kidneys and all because of the skin fluid loss. The case was very critical, but unfortunately, after 3 days of inpatient care, uh, he succumbed. Yeah, breaking the news is very, very difficult. One of the most difficult, because you yourself become emotional, that you were not able to help the person completely. That was a tough time. I have to learn that.
Thank you for sharing that. Being a woman in the medical field, how has it been?
I don't think there has been a much difference during my MBBS preparation, but during the residency, I have taken a branch of dermatology where we are more of the female candidates. It's more easier for me now. But yes, other branches like orthopedics, where the male counterpart is more, they do find it difficult at times.
And any advice to young doctors who are thinking about either dermatology or orthopedics, or a field where there are probably not many kind of women, right? I think orthopedics is a perfect example of that. What advice would you have for them for that?
The branch, your gender should not be a limiting point for it. If you like the branch, it is for you. You can do amazing in anything you desire or you decide to do. So that shouldn't be a thing stopping you from not taking that branch. I have a friend who is into orthopedics. She's a female. So, but yes, she's doing well. She's doing quite well. So that shouldn't stop you for it.
So, doctor, NEET PG 2024. First, the exam was delayed, then the counseling has been delayed, and there are thousands of young doctors who are sitting at home waiting on kind of where they would kind of be practicing medicine, right? And unfortunately, their hands are tied, right? What advice would you have to these young doctors who are sitting at home? Is there a way for them to be productive? Do you have any feedback for the government? Any feedback for the situation just now? Because I can't even imagine as a non-medical professional how frustrating it must be to not know where you're going to be practicing medicine next, although you've given the exam.
So the main thing here would be to take everything in your advantage, to use the time that you are getting now to work on yourself, on your hobbies, get to know what things you like, because all of this will help you during your residency when you want to just unwind. So work on yourself and know what you like and spend time with it. Like for example, during the second year of my MBBS, I was having a very tough time. I had actually lost hope from life itself. During that time was when I was searching for answers about life and things. They are very deep. So that was when I was introduced to yoga and meditation, and I remember joining the basic program by one of the foundations who teach meditation and yoga. And since then, I've been practicing yoga and meditation, and it has helped me unwind in each of the phase of my residency and even my preparation. It makes you more productive. It's not that you are giving extra time to it. It should be a part of your life. Like you have dental hygiene, there should be something like mental hygiene where you work on yourself, your mind more.
You mentioned that the second year of residency was very difficult for you. Would you mind sharing a little bit about the experience, and maybe it could help other doctors who are in a similar phase or who may reach a similar phase?
So that was that was a little personal. Actually, I have a twin sister who's more into designing and now into the designing of interiors. And there was a time when I would compare my life with her, that I'm not able to enjoy or do things that she is doing now. And it would make me lose hope on what my future would be with all the struggles. Eventually, people, when we come into MBBS and KEM, it's a ritual. Like people say, अभी तो ये MBBS पास करके नीट देना है, नीट की पढ़ाई शुरू कर दो करके. So it becomes very stressful and you feel like you're tied up. So that made me lose hope actually.
Well, I mean, it's amazing to see. Firstly, thank you for sharing that. And I think it's amazing to see kind of how far you've come in your journey, right? And I think I personally know so many young doctors who follow you on social media, who've heard your story, who've shared so much about kind of how they've got inspiration from your story, right? So I think kudos to you on kind of not just having so much strength, but also partaking the strength to kind of other medical professionals. Speaking of which, you mentioned you were always interested in the arts, right? Obviously, your twin sister is also, in some sense, an interior designer, but also, I guess, aligned to the arts, right? How do you feel today, right, as a medical professional, doing something different to what you hoped you would do? Do you have regrets? What are you proud of? I'm sure this will kind of help other people also be inspired as they make a decision towards go towards the sciences, right? Maybe the medical field as well, if they've kind of let go of another field to take down the more traditional path of medicine.
There are no regrets at present. The field, what you get to do in this field is not comparable to any other thing in the world. The amount of satisfaction while you treat a person or you decrease a person's suffering, it is not comparable to anything. But yes, don't do it for money as well. There should be a good amount of passion and that feeling of service to provide somebody warmth and comfort. Uh, yes, my hobbies like painting and all of that has helped me here in the field as well. In dermatology, I get to do small procedures and surgeries, especially on the face and other visible areas of the body. I have to be more artistic in those. Yeah.
Well, it's amazing, right, that you've joined the dots, right? There's this famous Steve Jobs speech, right, where he's in Stanford commencement, where he mentions that life is all about joining the dots, right? So, and personally, it's been a story of my life as well, right? I would not have become the founder of KNYA. I would not have, my wildest dreams of being an entrepreneur, but I feel like always life is about a journey of joining the dots, right? So it's beautiful to see that you take that perspective as well. So, doctor, what do you think is the role of social media today in dermatology, right? We see a lot of dermatologists building following on Instagram, on YouTube, sharing their techniques for skincare routines, for hair care routines. What are your thoughts on that?
Social media is a great platform for each one of us. Even we as dermats, so people are putting out content, and it leads to more awareness amongst everybody about the skin, about their skin type, about their skincare routine. It's also helpful for those who are getting into their own private practice because it leads to more visibility and you get more of the followers, which eventually will be in your clinics.
How has technology impacted dermatology today? And where do you see dermatology as a practice evolving in the years to come?
So technology, it is being used everywhere. In dermatology, the lasers itself, they have an amazing inbuilt technology of emitting different type of lights. It's used mainly in the lasers, and even we in OPDs, we use an handheld instrument called the dermatoscope, where you get to see the underlayers of your skin. It helps for an easier and more accurate diagnosis, and you are also able to see the improvement post-treatment. When it is not clinically visible, you can see it through the dermatoscope. There is telemedicine, like teledermatology, where we can consult even at a distance. So it becomes more better for patients and doctors as well because it reduces your waiting time and saves your time basically. But the only drawback would be that sometimes the patient-provided photos, they lack the clarity, and we as clinicians, we are not able to see it in face, and we are not able to palpate or look for the tenderness.
Yeah.
So all of that also becomes a challenge at times.
We spoke about mental health and the importance of mental health as a medical professional. But one thing that is a very important topic is about how we are seeing young Gen Z patients who are visiting dermatologists and aesthetic clinics to, in some sense, alter their skin tone, to maybe who are not kind of very comfortable with their body type, and they are visiting medical professionals to alter this, right? Now, today, as a dermatologist yourself, what advice would you give to younger patients and also to fellow dermatologists as well on how they could treat some patients like this?
So for the patients, most important would be to for the person to accept himself the way he is. There are a few things which are not under your control, like the genetics. So those things, one should embrace their inner beauty. That is what is most important. Not to just keep on taking different treatments for the external appearance. But yes, if the thing is bothering you, and if it is not changeable, then it would be better to for the person should to take some counseling in some or the other form. But if it is changeable, if for example during the teenage, people do have acne, and that's completely hormonal. So the teenager, he should be counseled about the condition, and he should be given hope that it is a temporary condition and it would resolve with time. But yes, taking topical creams and all is fine.
Couple of last questions for myself. Any advice that you'd give your younger self if you were giving the NEET UG examination today?
NEET UG, okay.
What advice would you give yourself? Would you want to do something differently?
One biggest advice would be to not stress so much about small. These things would matter eventually. Your rank, your that doesn't matter eventually. And to go through this process happily, not to take this as a sacrifice or a burden. That is what I would.
Do you have any questions for me today?
How did you start your KNYA Med?
So I think the intent is very simple, right? I think we started KNYA with the intent to celebrate medical professionals. I think the last couple of years have made us realize that the lives of doctors and nurses and technicians in this country is not ideal, right? People like yourself, I think you mentioned you do a 36-hour shift, and you were very, not even surprised when you said 36-hour shift, right? That's a big deal. That's a very big deal to go day in and day out and spend 36 hours in a hospital, meet 400, 500, 1,000 people and treat them, listen to their problems, solve their pains, right? And I think the biggest motivation for me and everyone who's, working towards this mission at KNYA, can we make the lives of medical professionals just a little bit better, right? And if they wear these comfortable scrubs, they feel a little bit better about themselves. And if they feel a little bit better about themselves, they can not just take care of patients, but more importantly, they can take care of themselves, right? So it's been a couple of years that we've been doing it. And I think a large part of this podcast and this conversation was that can we bring awareness to the work that doctors and nurses and technicians are doing in this country, so just we as medical professionals can start celebrating them, right? And non-medical professionals like myself can also understand and be a little empathetic towards the pain that comes in the day-to-day life, right? You spoke a little bit about how you face death, how you've seen pain live, right? Often people forget this, right? Speaking of which, doctor, have, it's something that we read in the newspaper every day. Have you or your colleagues faced any kind of violence?
Yes, it is. It happens frequently in the emergency wards and emergency room. It does happen.
That's very
People
sad.
are very agitated when they get their patients. Already the patient is in pain. Their family members are agitated. They are angry. It comes on all to us.
And how do you feel about that? Is that something that, as medical professionals, that you should do something? Should the system change? Should the administration kind of create laws,
There should
security,
be,
surveillance?
There should be more security. That is what is very important. There should be security for us.
And why do you think there's violence? Like, why do you think patients are agitated? Why do you think there's violence?
Patients have their own stories, so they are suffering by themselves, and that is brought on to us. It's just a way of, they get a way to just let out their emotions and frustrations.
Well, it's so sad, right? I think you've normalized it, that you think it's normal, but I think this doesn't happen in other professions. It doesn't happen in other offices. So kudos to you for having, I think, such a good attitude. But it's not normal, right? I don't think there should be violence on a day-to-day basis. And I'm sure your parents and your sister and your families not feeling great about this. So, doctor, you mentioned that currently as a resident, you've been spending 36 hours in the hospital, which is a lot of hard work, right? And in some sense, is a work-life imbalance, right? But you also mentioned that you picked dermatology because you felt it was a vertical where you may not have to spend that much time in the hospital, and there will be work-life balance. So, how do you kind of manage the dichotomy, and how do you feel about it today?
uh, this situation of like doing 36 hours of shift, it is usually only in the first year of residency. So I was firm in my mind that 1 year will be fine. Post that, the life, you get some time for yourself as well. When you know there is just a specific amount of time, 1 year, 2 years, or 3 years residency, it's more easier for you to pass through.
Makes sense. Makes sense. How do you think about your future plans as you are wrapping up residency? Where do you see yourself in the next 5 to 10 years?
Career wise, I would want to do something which is of benefit to other people. I haven't yet put a thought to it, but maybe work under somebody, get more experience for 1 or 2 years, and then maybe open my own thing.
One thing we spoke about was the importance of mental health, and this ends up happening, right, based on all the conversations that we've had with dermatologists, that people come for a particular issue, but often dermatologists realize that this could be a bigger issue, and often they may need to, refer them to a psychiatrist, right? Has that happened to you? Could you share a particular case?
There was one female, she was 20-year-old female with patches of hair loss, which were not patches actually, she was having a diffuse hair loss. We had to assess her, we had to see, we analyzed her completely, the way she was talking, how she was walking, how she came with her mother, crying and all. And after we put that dermoscope, the instrument, we found some features which were suggestive of a psychiatric condition called trichotillomania. So here the patient, she pulls her hair herself with her hands, and that is the time when we had to refer her to a psychiatrist. So we counseled her about the condition, and she's doing fine now. Counseling is very important for such patients.
Thank you for sharing that. It's been a now couple of months since the Kolkata incident, right? And it's an incident that shook the entire nation, right? Not just doctors, nurses, but everyone, right? It was a conversation that we all had. I know at KNYA we've spent a lot of time talking about it. How can something like this happen in the workplace, right? As a woman doctor at Seth, GS Medical College and KEM Hospital, what was the environment and what is the environment today there?
There is increase of security. Even at the entrance, there are guards now. Previously, they used to just sit around and all, but now they do check at times. And the wards are more emptier. Previously, each patient would have 4 or 5 people with him, but now there are only 1 or 2 relatives which are allowed. So it's becoming more streamlined and better now.
So, but what happened in Kolkata was very, very unfortunate. But would you say that that incident has brought some change and some more awareness with regard to the security of doctors and nurses in this country?
The security has increased, but there shouldn't be more. There shouldn't be such an incident that has to be there to open your eyes. It should be a normal thing to have a
Absolutely.
proper security in a hospital. Hospital should be one of the most divine or purest places, and such things happening is a shame. It's seriously a shame.
I would like to move to a some rapid questions if that's okay with you, right? Could be fun as well. If not dermatology, what other branch would you have picked and why?
Pediatrics. I like children.
You like children, that's
Yeah.
why. If you want to pursue either cosmetology or core medical conditions in dermatology, which would you prefer?
It would be a mixture of both.
And if you had to pick one?
Core, because I feel it's more satisfying.
Attending a medical conference for dermatology or going to the mountains?
Going to the mountains. I like trekking.
What is your skincare and hair care routine?
To be honest, I use very minimal products. Only a moisturizer, a sunscreen, and a face wash, and a plain shampoo with a conditioner.
If you want to help dermatology move to the tier 3 cities or rural areas, what would you do?
maybe create more camps and bring more awareness about the skin conditions, and their daily routine of the skin.
Final question. If you were given the chance to go back to 10th grade, would you yet choose medicine or would you have picked another career?
I would have chosen medicine. As I said, it is very, very rewarding. It's not comparable or with any other branch. It's worth all the sacrifices and all your efforts.
Well, Dr. Rajvi, it was an absolute pleasure. Thank you so much for coming by and having a conversation with us, for sharing some of the deepest learnings on why you're a dermatologist and feedback and guidance to younger doctors who also want to take up dermatology. I know I personally learned a lot from this conversation, and I'm very, very inspired by what you've built with your professional career so far. So thank you again for coming by.
Thank you.
Thank you so much for watching. Please like, share, and subscribe to our page. Do share it with all your dermatology friends. And in the comments, please tell us your favorite part of the podcast. Also, tell us where you're watching this podcast from and any feedback or suggestions that you have for us. Thank you so much.